The Executive Master's in Healthcare Administration program here at Cornell University is for the working professionals in the modern healthcare industry. We've really tried to make this program about you. We want it to work with your working life, but we also want to be able to leverage all that experience and expertise you've acquired to enrich your educational experience as well as the educational experience for all those around you. To bring a new product that can really respond to today's learning environments, learning needs, and to be able to be accessible and exciting that you can thrive in, that you can succeed in, that can help you to take on that next level, that next jump in their career to be a future healthcare leader. Cornell is such a rich and vibrant community that our students feel a deep connection to this campus, to this university, to its culture, to its network. And when I say be a part of Cornell, I'm talking about around 2,000 alumni in healthcare administration programs alone, but also around 250,000 alumni from Cornell University that span the entire globe. And so we're excited to have you be a part of the Cornell community and our executive program.
The Executive Master's in Health Administration at Sloan and eCornell has had a really big impact, especially not just on my personal life, professional life, but I think on the ethos of who I am.
I wanted to get something that is applicable to what I do. I'm living through the healthcare world on the hospital level day to day. I think this provides a higher level perspective that gives me better structure and understanding of what I do.
When I started looking into the Cornell program and saw that it would provide the rigor that I was looking for, I really wanted to learn and grow as an individual, as well as if I was going to invest the time, I wanted to make sure that I was going to exit the program better than I entered.
Honestly, the online program was perfect. As a physician in our career, you can't just take time off. But Cornell was unique because the curriculum addressed every single area of my planned career that I needed to master to be the best that I could be.
The asynchronous classes are super flexible. They've been super engaging. The strength of knowledge of the instructors has been excellent. We've gone from what I thought would just be a group of students that I would interact some with to an extended network that I know is going to last for the rest of my career.
I think the EMHA helps you understand where the landscape is going. When the people get to the hospital, it's too late. When you're ill, it's too late. Prevention's already failed. And I think that's what I wanted to do. I didn't know anything about health laws, anything about how economics of healthcare worked.
Because it's not in person, I have the additional flexibility of planning out my days, finding spots that works for my own schedule on where to invest the time and when to do my study, when to do my homework.
With a little planning, I'm able to still be a present mother and a present employee and a present community member. And I'm still able to learn and connect with my cohort in a way that is enriching.
It's all about time management. It's realizing that this is 18 months that you really have to dedicate yourself, but it's going to change your perspective, your outlook, and how efficient you are as a manager for the rest of your life.
It has really empowered me, given me so much more confidence in myself and in my skills. The experience I've had here has made me feel that I can do whatever I want to do.
Not only is the instruction world-class, but the folks in the classroom, the infusion of new ideas, the level of professionalism among the group is amazing. I can't say it hasn't been very challenging, but that's what we signed up for. If we didn't want to be challenged, we probably wouldn't have chosen Cornell.
It's completely changed my feeling on what I want to actually do in the next decade, right? I live in DC and I'm dabbling into health policy because even if you make a 1% change, it changes the lives of millions of people. We need to do more. And how do we do that, right? And if you want the tools, you want the resources, then you need to somehow educate yourself. And the best way to do that is the EMHA.